Pubic symphysis pain can be really intense. It's a pain in the front of our pelvis right here. It usually amplifies when we do transitional movement. So when we get out of a chair, when we try to take a shoe off, when we put our pants on, these things are really gonna aggravate it because you're loading one side. So during pregnancy, there's a lot of biomechanical changes and there's a lot of weight on that bone. There's also ligament laxity, but the great news is there's a lot of things that we can do to change it. If we make the muscles more symmetrical that attach around the pelvis and take a little bit of pressure off the bone, it can go a long way. So step number one is to stop aggravating it during the day. If I'm standing on one leg, it can create the shearing in the joint. So what I would want to do is I want to sit down as I take my shoes off and then take my shoes off, or my pants up and down, sit down. When I'm sitting for work, I want to sit all the way back in the chair. That way there's not so much bone if I'm so much pressure if I'm perched right on the front of the chair. So to make the pain decrease, we want to strengthen around this area. There's some common ones that people are going to do. We want to make sure that we're getting some mobility. So we want to open up our chest because our lats help support our pelvis and take pressure off of our bump. So I'm going to do these chest openers, opening my thoracic spine. I'm going to switch to being in quadruped, and then I'm going to do pelvic mobility. So my pelvis is just sitting tucked underneath like Michael Jackson, then letting my back arch a little bit. Tucked underneath, letting my back arch a little bit to create some movement. Once I've created movement, I really want to strengthen around this area. So I'm going to go band around the foot. If that's painful to put it on, sit down while you do that. I'm gonna go feet wide, and then I'm just gonna do like a quarter squat. I'm pressing my legs outward as I'm squatting down. This is gonna help engage my glutes and create some closure over those joints so it's not so painful. So as low down as you can go without any pain, sitting back nice, keeping my spine nice and straight, so butt backwards, really thinking about lengthening the glutes out as I do this. Then what I'm gonna do is I'm gonna strengthen some of these beefy muscles on the side that help support it as well. So for that, I'm gonna lay it all the way on my side, knee bent, legs straight. I'm gonna lift, lower the leg, lift and lower the leg. Nice and small controlled movements. I'm not hiking my hip up as I do that. I'm gonna do about 15 reps of those guys, and I'm gonna switch sides. Now, here's where we make it specific to your body. Usually there's pulling or tugging in the groin, and we're gonna try to figure out which side is creating that. So to do that, I'm gonna sit down on a chair. I could use a ball or like a yoga block, anything I'm gonna put between my legs. I'm gonna sit back in the chair with my knees just draping over. Now what I wanna do is think about this guy being a shotgun. I'm gonna pull the left side of my leg backwards, kind of like I'm filling out my butt more, and I can even think about scooting back on that side. Then I'm going to squeeze inward. Does that make your pubic symphysis feel better? If the answer is yes, that's the side you want to do. If the answer is no, I'm going to switch sides, and then I'm going to drive this right leg back to fill out my butt cheek and then squeeze in. Is this the side that makes it feel better? Then you're going to want to do some reps on this side with that leg engaged back a little bit more. The next thing that would make it specific to you is figuring out which hamstring is out of balance. So to do that, I'm going to sit nice and tall in the chair, and I'm going to pull this band back, and whatever side again is easing your pubic symphysis pain, this is the side that we want to do in reps. So we have a free printout for you guys that you can download and do this in your daily activity. If you do it even for a couple weeks, it will make a huge difference on your pubic symphysis pain.